So we've had a really great selection of questions come in, Rob and Joelle, and we'll select some of these. As we mentioned earlier, we won't have time to get to all of them, but we'll follow up with an email to everybody with answers to the questions we're not able to cover. But here are a couple ones that came through. Has the CDC changed the hand wash scrub time recommendation, and will we see that as a permanent change, or is that just for this pandemic?
That's a good question. They changed it because of this, but I don't necessarily think that, again, one of the things about hand washing is 20 seconds is a long time. 10 to 15 seconds is a long time. Getting individuals to do that, obviously as a microbiologist, I'd love to see 20 seconds because that's really getting into washing those hands and covering all the surfaces. But I don't know the answer to that. The longer the better, we believe. So I think that's the reason why they added the 5 seconds. Again, any mechanical action is going to be better than none. But we really are trying to emphasize now, and why it has been increased is we're trying to emphasize so we are removing that virus, because that is one of the only ways that we can get it off of our hands.
Does a medical professional need to take the temperature of an associate before their shift, or is there a training that staff can take to properly do this?
There is no, a medical professional does not. CDC is saying that does not have to be a medical professional who does that. They are stating that certain thermometers can be used. Ideally, one that is a surface temperature probe is something, but we are recognizing the fact that those are hard to find now. But certainly we are more recommending the surface type temperature probes, and an elevated temperature above 100.4 is really what they're starting to look for. More of that information can be found on that CDC link, what to do and that we have put on the resource.
Can you kill a virus at all, and isn't a virus non-living?
So that's a bit of a debate in biological circles. And for the most case, I don't think viruses actually meet the definition of life. However, so we generally refer to not killing. We use the term killing, but what we really mean is inactivate or render them unable to cause an infection, or trying to render them non-viable.
How can people get multiple negative tests to return to work if no one can even get tested?
That's a very good question. We are experiencing that. And so that's the reason why there are two methodologies that CDC has given for return to work. They're absolutely recognizing the fact that people may not be able to get tested. So that's why there's the two scenarios. Rather than just the one that you must get tested to reach and have two negatives within 24 hours. That's why they're giving those two scenarios, because they realize the fact that will be a difficult task.
Should we be wearing masks to harvest produce? Excuse me.
I think I talked a little bit about this, and I think if social distancing can't not be. Hey, the one thing about being outside is you're outside, and you can social distance pretty well. But there's going to be times that you may not be able to do so, and so wearing a mask where social distancing is not cannot be followed. I think wearing a mask is recommended.
Is the schedule of food safety inspectors expected to change?
Sorry, can you repeat that again?
Sure. Is the schedule of food safety inspectors expected to change?
Well, FDA has already made an announcement that they are doing more of a for-cause inspection. So if they've gotten a complaint or if there's a food safety issue that they've identified, I know that they're still inspecting for those things, but they are definitely, as well as state, at least I know in Virginia, our state regulators are also on a for cause. Depending upon your state, that may be different. And then, like I said, USDA, it has not happened yet, but USDA does have a plan in place that they did announce that states that if inspectors become absent and their workforce is diminished, they will focus more on slaughter facilities and allow facilities that meat manufacturing facilities, they will allow to continue to work without a continued inspection. But again, I'm going to emphasize this, record keeping is hugely important during this time.
We've been getting quite a few questions about how to handle all of this for workers in the field, and in particular, we've had a question come in about the best practice for safely harvesting produce from the field, and we've had some questions also about are there any designs or types of masks that would be more comfortable for field or packing house workers?
I think and this is a really good question, because there is a difference, or we want, and CDC does a good job of this, of delineating between a mask a face covering, a cloth covered face covering that is effective in versus one that you just can't breathe. And so we are dividing, we're kind of straddling that line. You absolutely don't want to have something that a face covering that is so doubled over and so many layers of cloth that the employee just can't breathe or is extremely uncomfortable, because number one, that's dangerous to their health, and then number two, they're less likely to wear that face covering. So right now, and it's also in your resources, Wake Forest has done some research, and they have said that 2 layers of 180 count or greater cotton works well. That's quilting cotton, or a layer of cotton plus a layer of on the inside, a layer of felt that is very effective in reducing droplets from being transmitted, but is very comfortable. So you'll see that on the CDC website.
Will all of these guidelines be the new norm even if the CDC finds a vaccine?
So, this is a new situation for us, even though it may seem like at this point it's gone on for a very long time. The reality is, as far as the science and as far as recommendations, I think those are going to stay in flux until this is resolved, and so that may be some time. So it's unclear exactly how the public health agencies are going to respond. So the short answer is we just don't know going forward, but we do expect that there will be some changes, but we just can't really articulate what those might be at this point.
And I think it's also important to understand that, and this is coming from an epidemiologist friend, is that this is gradually returning to our normality is not going to be a flip switch. It's going to be a gradual return. So we are going, as we saw things and policies put into place gradually as the disease escalated, we're going to also see de-escalation in that manner. So it's not going to be something that we're just going to switch on or off and everything's going to return back to normalcy.
We've also gotten several questions related to farmers markets specifically, and we have one here that a person asked about running a drive-through farmers market, and they're finding that the gloves are not as useful, especially as they see so many vendors touching their masks with their gloved hands. They want to be safe and also be perceived as safe, and they think the gloves are falling more in the, quote, perceived as safe category right now.
Yeah, so glove use is always a really big question when it comes to whether or not the person perceives that the glove is there to protect themselves, or whether or not the glove is there to protect initial contamination that can then therefore be transferred. Again, using proper hygiene with gloves, changing gloves frequently, or using the hygiene steps that Joelle talked about is important to make sure you don't transfer that virus. So it depends on the people you're working with and sort of the level of training they have received in the area. But people really, they need to understand that the issue is transferring the virus, whether it's on a hand or a glove, to another part of their body, like their face, for example, or transferring secretions from their nose, for example, onto a piece of produce or a piece of packaging material, and then people handling those things. So that's the issue. It's the issue of how that's used, and it really the training that needs to take place and sort of the encouragement that needs to take place is pretty much each individual person.
There's a question that we received earlier on in the presentation, and it's a study that was conducted at MIT that said that a virus could spread over 20 feet and linger in the air for up to a couple of hours. Could you all speak to that?
I haven't read that particular study. I did see a short report on that, and so they sort of looked at the dynamics of flow if someone coughed, and I believe that's the same study I'm referring to. And they looked at the dynamics of flow and found that yes, that the virus can travel long distances, and also it can remain in the air for more than a couple hours in some cases. So, but that's a modeled situation, and that's going to vary based upon location. It's going to be based upon ventilation, airflow, and things of this nature. So it's very difficult to say exactly what the parameters are for any particular space. So I think it's important to absolutely keep maintaining that social distance, face coverings, and don't go out if you're sick.
We had a question earlier too, Rob, that you had mentioned that microbiologists they're trained not to touch their faces. Is there a recommended protocol for this training?
Well, they scared us to death. That's pretty much the statement was, you're touching things that can give you foodborne illness, so it's going to make you feel worse than you've ever felt in your life and could potentially put you in the hospital or even kill you. So don't put your hands near your face. And that was pretty much enough for me. And also, I think one of the aspects that when we were learning aseptic technique and personal protection in a food microbiology lab, it was just widely practiced. A lot of it was by example. And first of all, we were trained, but the other was by example. So it's really hard, especially for people to live up to that example, but they certainly need to do that.
And I think it's also very important, having been in the food processing setting, is let people know if you do see something, and don't make it something that is intimidating, but let them know, hey, I just saw you touch your face, and you might want to reduce that, and hey, you should go wash your hands. Allowing a food safety culture in your facility is really, and make it something that is non-threatening, is really important, even with food safety, but especially important in this day and age.
Can ozone generators reduce viral load in shared airspaces?
Ozone. So ozone is a really tough question, because ozone is a strong oxidizer, so it works very much like chlorine, only at a higher level. The problem with it is applying ozone in such a way that it interacts with the organism, or in this case, virus, in such a way that it's in contact at the right concentrations for long enough time in order to cause inactivation. So I'm not aware of any studies that have looked at this virus in terms of ozonation of the air. I would think that there may be some studies that come out on that in the next few years. However, I am not aware of any right now, so I can't say any type of efficacy that anyone has seen.
We've had a couple of folks have questions regarding allergens, and so we had a question earlier about allergies are pretty common right now, but people can spread the virus without showing symptoms. Would you recommend those who are suffering from allergies stay at home as well?
So, that's probably something we should look at to see what the CDC recommends on that. I think, clearly those with allergens are not just from the allergen standpoint going to create an issue, but it creates concern among other people who are with the runny nose and the sneezing and these type of aspects. It's not typical for someone with allergies to have a fever. So that's one aspect. But again, what we want to do is make sure that in any regard, we want to make sure we're using that personal protective equipment, face coverings. We want to make sure we use good hand hygiene, so social distancing. And so all of these aspects are things that we want to keep doing regardless of whether or not we think we are or not infected.
Great, thank you. And I think we have time for one more question. And someone asked earlier about cell phones. They haven't seen any guidance about cell phones. How would you all respond to that?
Well, I mean, cell phones are going to be important in terms of maybe communicating. You know, we're at a time where social distancing is absolutely required, and so cell phones is a way to communicate via distance. However, what I am recommending and what CDC is recommending is that absolutely is something that should be possibly put on the list of being something that needs to be disinfected, and using one of those EPA listed or CDC recommended disinfectants. And alcohol is one of those. 70% alcohol is one of those that is recognized. So but I do understand the use of cell phones might increase.
So one of the questions that's come up is the ability of sunlight to inactivate this virus, and that kind of rolls into the question of ultraviolet light. When we talk about ultraviolet light, we're really talking about three major categories of light based upon wavelength. You have UVA and UVB light, which does reach the surface of the Earth from the sun. Those have not been shown to be effective at all in reducing the viability of the virus or viruses similar to this type of virus. Okay, so sunlight is not an effective way for killing the virus. UVC light that's used for germicidal UV light is certainly effective. However, it is not something that we get from the sun, at least down to the surface of the Earth. It's blocked by the ozone layer in the upper atmosphere. We certainly would not want to be exposed to UVC light because it wrecks genetic material. It wrecks DNA and RNA. So because of that, those who are using ultraviolet light treatment systems in facilities that have UVC light may get some effect, but we don't know how to quantify that yet. So we don't know how effective it is for any particular food item for this particular virus.
Okay, we are now at noontime. The team is more than happy to stay on for a little bit, but we are at the close of the time that we've allotted for this. So again, we want to thank everyone for coming today and for the fantastic turnout we've had. And we will be getting these out to you hopefully by early next week. And thank you all so much again.